Dr. Owashi, tell us about yourself and why did you go into medicine? What brought you into the medical field?
I grew up as an only child, very close with my parents. My dad is an emergency room physician, so at a very young age, he always taught me the importance of helping other people and how you could make a good living for yourself while at the same time making an impact on the community. And I've always enjoyed helping people because of my dad.
Describe for me your medical schooling and what was something that stuck with you about your program.
So my medical school, I was over at Wayne State in Detroit. We actually had the largest class in all of the United States. We have over 300 kids per year in our medical school. So our medical school is huge, which is great because I was able to find my close group of friends rather quickly, and I was able to make lifelong connections that I'll have the rest of my life.
What is your profession?
I'm an orthopedic surgeon that specializes in hip and knee arthritis, and I'm fellowship trained in doing hip and knee replacements and revision hip and knee replacements.
What does your fellowship mean to you?
Fellowship means is like, everybody becomes an orthopedic surgeon, and then typically nowadays people like specialize in a particular area of orthopedics. There's a different, orthopedist for your foot and ankle. There's an orthopedist that specializes in shoulder and elbow. There's people that work on just the spine. There's kids that work on peds or just kids or people that work on tumors. My fellowship training was in hip and knee reconstruction, so hip and knee arthritis, where I focus mainly on taking away people's debilitating pain from arthritis. I give them a brand new knee, brand new hip, and they're walking that same day. And a couple months down the road, there's no more pain, and they're back to doing everything they want to do in life.
What specialized training do you have or want the public to know?
My main specialty that I treat is I'm fellowship trained in hip and knee arthritis, which means I treat all types of hip and knee arthritis. I do hip and knee replacements all the time. I do those procedures approximately 300 to 500 times a year. I'm specialized in both hip and knee replacements, hip and knee revision knee replacements. I do partial replacements for the hip and knee, and I also do robotic knee replacements.
Where do you practice? What location do you practice at?
My office is based here at AVORS over here in Lancaster. I operate in their surgery center at the Embassy on the 3rd floor of our building in Lancaster. I also operate out of Palmdale Regional Medical Center and Antelope Valley Hospital.
What do you bring into this medical group?
I bring a lot of training and specialty training in hip and knee arthritis. I like to believe I bring a fresh face to the group with different approaches and different ways of treating people's arthritis. And I'm trying to treat everybody like I would treat my family members, with a bunch of respect and care and love, and just make sure they understand that I'm trying to help them as best I can.
What services do you offer?
So I do conservative treatment for hip and knee arthritis. I offer treatment to help people take away their pain with ambulation, with pain in the knee or the hip. Usually I first start off with treatment for knee and hip arthritis with anti-inflammatories, maybe some physical therapy. If they have consistent pain with walking, then we start off with injections. And eventually, once the injections don't work anymore, or if their arthritis is too severe and they're having debilitating pain with every step they take, that's around the time we talk to them about doing hip or knee replacement surgery, which will take the pain away permanently and get them back to doing everything they want to do about 3 months after surgery.
How long are your appointments? What might make you late?
We have a lot of people we need to see in our office, and our office makes a real big importance to make sure that the patients can see the orthopedic surgeon in a timely manner, which means we see a lot of people in our office. Well, sometimes we'll see 80, sometimes 100 people in a day, which means my time with the patients has to be fairly short. While at the same time, I make a conscious effort to make sure every single question gets answered and everything is explained thoroughly to the patients. So sometimes what will make me late to see the next patient if I'm spending a little bit too much time with the previous patient, but really that's because I want to make sure everybody's questions and concerns gets addressed per patient. While at the same time, we don't limit how many people we see per day, because if you limit how many people you see per day, sometimes patients are waiting like 2 or 3 months just to get in to see the orthopedic surgeon. So for us, we try to see a lot of people every day, as many as we can, which means patients may have to wait a little longer to see us, but they will actually get seen within a day or two of requesting the appointment.
Tell us an interesting thing about your profession.
My profession requires me to use a lot of power tools and power equipment. So in the medical field, the orthopedic surgeon is kind of regarded as a carpenter. Instead of using wood for our work, we use people's bones. So a lot of times in the operating room, I'm doing cool things, like I'm using a power drill, I'm using power saws to remove all the cartilage, I'm using a big mallet to mallet on the implants. So we're actually doing a bunch of hands-on kind of carpentry work with bones, and it's a lot of fun.
Why should one trust you with their care?
I would say because I'm a genuine person that really has the patient's interest at hand, and I want to provide the best quality care possible. And I'm very specialized in what I do. I do these particular surgeries, the hip and knee replacements, approximately 300 to 500 times a year. I feel like I'm very adept and accustomed to doing all these type of surgeries, and it's been leading to really good outcomes for my patients.
How do you show patients you care for them and that they are not just another patient?
I think I show patients that I care for them just based on my bedside manner. I feel like patients, when I interact with them, they really know I have their interests at heart, and I want to, resolve their pain and get them back to doing everything they want to do in life. I feel like patients kind of understand that just by, kind of talking with me and just having interactions with me. They know I want to do everything that I can to help them to the best of my abilities.
How would a patient describe your care?
I think patients would describe my care as thorough, and that they could really feel that I really care about their overall well-being, and that I want to try to alleviate their pain as best as possible. I would like to think that they would feel like taking care of them as I would take care of one of my family members.
What do you want the public and your patients to know about you as we wrap up?
I would just want them to know that I got into medicine not to make money. I got into medicine really to try to help people, as many people as I can, and that I have a real passion for doing hip and knee replacements. And then I want them to know that their limbs are in good hands if you trust me with your care.
What do you do for fun?
So for fun, I spend a lot of time with my wife and my 2 dogs. We have 2 corgis at home. One's about to be 4 years old, one's 2 years old. We spend a lot of time with them. I spend a lot of time with my friends. I play basketball every Sunday. Other than that, I'll be rooting for the Lakers and watch a lot of sports. Other than that, I spend other time with my dad. We like to go fishing and just kind of hanging out with friends.